We can also talk about stopping pain after exercise. So if you're actually having some pain, what are some things you can do to stop pain after exercise? What could be happening, I think, is a first good point to start. You might just be having general muscle soreness, which is completely normal. So if it's a little bit tender, if it's a little bit sore after working out, simply resting, getting enough calories and protein in your body, that's going to help you to recover greatly. Doing some light active recovery, maybe you get on a bicycle for a little bit, kind of do some walking, all these different things. I do a lot of walking, actually. That's kind of my form of active recovery, some incline walking occasionally, but some light activity that's going to promote blood flow through the area, promote overall recovery. That's crucial. And then also being consistent with your exercise. This is something that people don't realize with general soreness. If you're really sore after working out, this usually is because you're not doing exercise frequently enough. And that might seem like, why in the world is that the case? It's simply because the stimulus isn't novel anymore. And usually novel stimulus, or as a new stimulus, is what increases soreness, general soreness after exercise. So by doing it frequently, you're basically decreasing the novelty of that exercise. So that's kind of general muscle soreness. This is very normal. Basically, you're just going to have to let it run its course. Doing stuff like foam rolling, stretching, all these different passive modalities, they help sort of, but it's not really worth your time. This is kind of more of a psychological thing, if anything, as we talked about. Pain and your brain are highly associated. Again, if you have time to do those things, absolutely, but just trying to get rest, getting enough sleep, that's crucial. In addition to this, we can talk about joint stiffness. So if we're talking about trying to reduce joint stiffness after a workout, I also want to reiterate too that joint stiffness is somewhat normal. But if you do have joint stiffness long term, this could be showing you that, hey, my overall exercise routine might be a little too intense for me. It might be a little too intense overall. So make sure your dosage of the exercise or specific movements are tolerable. Do some light activity, again, that's going to help promote recovery and blood flow through the area. Extremely crucial. And then, of course, this next portion is more acute injury or flare-ups. Somebody who went to the gym and they quote-unquote tweaked their back. I would highly recommend to avoid doing complete rest. This is an error that a lot of people make when having flare-ups or tweaks in their body. You want to do a very, very small motion. This happened to me a couple weeks ago. As I described, I tweaked my back and I did very, very, very light deadlifts. I was doing basically almost bodyweight deadlifts for a little bit, just moving through the range of motion. And this is exactly what you should do. You should try to ease into exercise. You should try to ease into the loads and volumes over term, so you can hopefully get to normal loads in time. When you have acute injuries on quote-unquote flare-ups or just back tweaks, something I want to remind you is that most of the time when these things happen, they do get better on their own without any intervention at all. So trying to force it sometimes and do too much, like all this stretching, icing, etc., do some light activity. It might be a little uncomfortable, a little painful, but realize that over time it will get better. And that's something that you can tell your brain, which will psychologically help to reduce your overall feelings of pain when you're doing exercise. And then the last portion is chronic pain and injury. So how to stop chronic pain after exercise. This is where it gets kind of tough and tricky and very nuanced. I would simply tell people to do what they can, still avoid complete rest, try to exercise and work the rest of your body. Find literally any activity that doesn't lead to pain. If you are somebody who has chronic pain in your lower back and all you can do every single day is just get a little bit of exercise on a stationary bike, that's great. Just stick with that. Try that to begin with, right? Hopefully over time your body gets used to it. I do want to say with the caveat though, if you are dealing chronic pain, it might be a point where maybe you should see a doctor if it's really getting that bad. Of course, exercise intervention like physical therapy can help and usually does help for most people. You might need a little bit more extra nuance at some point.